Respiratory therapists and nurses from some Intermountain healthcare hospitals have been transferred to southern Utah to meet the growing demands there as COVID-19 cases and hospitalizations continue to soar. ABC4's Katie Corrales reports.
Healthcare workers provided a sobering glimpse into life inside Dixie Regional Medical Center on Thursday, asking the community to come together to stop the spread of COVID-19.
We've done it before, we can do it again, and now's the time to do it.
As COVID cases and hospitalizations continue to spike to levels higher than ever before, healthcare workers from other areas of the state have been asked to provide support in St. George.
As difficult as it is, that's what gives me hope. Is the care that we give these patients.
Night shift ICU nurse Heather Anderson shared emotional experiences with patients struggling without human touch and connection, asking the community to take the pandemic seriously.
They die alone, they get the treatment alone. So we ask very much so for your help.
This week, the percent of individuals testing positive in Washington County reaching a high of nearly 20%. And last week, staff said the hospital saw more COVID patients 85 years and older than ever before. The ICU nursing staff are now working an extra shift every 4 weeks. And despite the increasing demands, the ICU is still looking for 2 additional nurses on each shift. Some nurses starting at 6 a.m. and working until midnight. Looking towards the holidays, staff say it's an opportunity for creative solutions and to consider foregoing traditional plans as an act of love and charity.
I care enough about you, and I care enough about my community. I care enough about Heather, our ICU nurse, and her colleagues, that we're going to find an alternative way to do this year.
While the hospital is not at the crisis care stage yet, they say they do not want to get there. And if the community can come together taking simple steps, the public can reverse the alarming trends. Katie Corrales, ABC4 News.